Okay, thank you. First of all, I would like to thank the members of the European Parliament for their presence and attention, and the ENVI Health Working Group for providing me with this opportunity to help spread the word about complementary and integrative medicine, and thus help improve the patient's quality of life and choices. In this brief talk, we will introduce the application of integrative medicine to the cancer patient, a particularly needy group. Let's talk about integrative oncology, complementary medicine in the prevention and support of the oncological patient. There is no disease more traumatic or with greater psycho-emotional and physical impact than cancer. It has tremendous burden on society and our health systems. Cancer is responsible for more than 25% of total deaths in Europe and is the leading cause of death between the ages of 45 and 65, a number increasing every year. 1 in 2 men and 1 in 3 women will develop cancer within their lifetime. In 2020, almost 4,400,000 new cases were diagnosed and almost 2 million died of cancer in Europe. These numbers are projected to increase by 70% in 2040. The total cost of cancer was 199 billion euros in Europe in 2018. Cancer is a multi-causal disease with an uncertain, debilitating prognosis and illness progression that leads to multiple sequelae and pathologies. According to the BEACON-5 study from the National Cancer Institute of France, 5 years after cancer, 64% of patients suffer from sequelae. 50% are limited in their physical activity, and 49% suffer from fatigue. These causes of cancer are multifactorial and mainly linked to lifestyle, which implies that they could be modifiable. Such causes are not addressed in conventional oncological treatments, which focus mainly on tumor reduction. One of the main contributions of integrative oncology is to provide a medical supervision of these causes and lifestyle changes, which is essential for patients to prevent, defeat, and avoid post-treatment cancer relapses, always as a complement of conventional treatments. Through lifestyle supervision, nutrition, emotional and psychosomatic support, and application of complementary medicine, integrative oncology can play an important role in the quality of life and clinical evolution of the patient. Some of these causes can be seen in this slide. At least 51% of oncology patients admit to taking some type of complementary treatment. According to other sources, the percentage is much higher. So in pediatric oncology, this percentage gets to 80%. But what is integrative oncology? It can be defined as the coherent combination based on scientific evidence of complementary medicines with conventional treatments in a personalized and holistic approach, always showing consideration and respect for conventional cancer treatments, but targeting people in their wholeness, body, mind, and emotions, spirit. Integrative oncology is not synonymous with alternative medicine. It does not reject conventional medicine, but instead tries to complement it. It does not accept either any alternative treatment uncritically, but rather incorporates complementary treatments that have demonstrated sufficient scientific or clinical evidence to benefit the patient. Integrative oncology improves health, biological condition, quality of life, well-being, and clinical outcomes. It also seeks to empower the patient so that he can prevent recurrences, help him in his emotional, psychosomatic stress, and make him an active and conscious participant of how to optimize his condition for prevention, treatment, and post-treatment of cancer. Evidence of the need for complementary treatment is that the United States includes integrative oncology services in the public health system, through 45 national cancer centers. 60% of these centers have integrative doctors. The most common therapies offered are 91% consultations about nutrition and food, 73% acupuncture, 84% dietary supplements, 67% herbs, and 69% meditation and yoga. In pediatric oncology, integrative oncology has been part of service portfolio for years and is the indicator of excellence in care. In Europe, some public hospitals already offer integrative oncology services. These include the Charity University Public Hospital in Berlin and the Pediatric Oncologic Center in Sant Joan de Déu in Barcelona, among others. The most widely used complementary therapies in integrative oncology are nutritional medicine and food, traditional Chinese medicine and acupuncture, intravenous vitamin C infusions, ozone therapy and oncothermia, nutritional supplements.
Just one moment. You have to pass the slide because you went atrás, you went behind.
It's not passing?
No, now. Perfect. No, now this one you did, you put it already.
Okay. Okay, we are in the slide 6, I think. Yeah, we are talking about the most widely used complementary therapies that is used in integrative oncology, which are, it's the slide, nutritional medicine and food, traditional Chinese medicine and acupuncture, intravenous vitamin C infusions, ozone therapy and oncothermia, nutritional supplements and herbal medicine, emotional stress support, homeopathy, yoga and meditation, exercise and aromatherapy. Certain therapies have shown a very good quality of scientific evidence, such as nutrition, acupuncture, TCM or traditional Chinese medicine, and oncothermia. Others have lower quality of evidence for not having randomized double-blind studies, as these are very expensive. That is not to say that these therapies could not be used as palliative care or adjuvant treatment in cases of good clinical efficacy, when there are no better options to be offered, which is frequent in oncological processes. Now I will briefly highlight some treatments for their efficacy, safety, and scientific evidence. Nutrition in cancer. There is significant scientific evidence on foods that pose a cancer risk and foods that have the potential to fight it. It's logical to procure cancer-fighting foods intake, plant-based, and avoid or limit foods that can predispose to cancer, such as processed red meat, alcohol, or others, as is recommended by the World Cancer Research Foundation, the American Institute for Cancer Research, the World Health Organization, and other reputable sources. In addition to promoting the prevention and fight against cancer, adequate nutrition and supplementation can reduce inflammation, detoxificate chemo and radiotherapy effects, increase energy, mood, and immune strength of bone marrow and vital organs. To sum up, nutritional medicine can improve adherence to treatments, quality of life, and chances of survival. Ozone therapy as oncological adjuvant treatment. Ozone therapy improves oxygenation of tissues and has a powerful systemic antioxidant effect. This allows cancer patients to improve their quality of life and reduce toxicity of cancer treatments. Among other beneficial effects, ozone therapy can reduce refractory pain and healing delays of post-radio and surgical wounds. Ozone therapy can also combat fatigue and reduce lymphedema, all this without side effects. Oncothermia. Based on modulated electrohyperthermia, oncothermia has a good level of scientific and clinical evidence. More than 400,000 treatments are carried out annually in the world. It's used in several university hospitals in Europe, Asia, and the United States. It effectively helps in the reduction of tumors without side effects. It's complementary with chemo, immune, radiotherapy, and surgery, increasing effectiveness as many studies have shown. Some examples of tumor reduction can be seen in this slide. Traditional Chinese medicine and acupuncture are treatments with high scientific evidence. They help in different conditions of cancer, such as pain, nausea, and vomiting, serostomy, hot flashes, fatigue, anxiety, depression, and insomnia. In the main Chinese cities, conventional cancer treatments are usually accompanied by traditional Chinese medicine, herbal medicine, qigong, massage, diet, and acupuncture as support. In the public Hospital of Sant Joan de Déu Pediatric Cancer Center in Barcelona, there is an Integrative Oncology unit. Inspired by pediatric oncology reference centers in the United States, such as Boston Children's Hospital, Memorial Sloan Kettering Cancer Center, Dana-Farber Cancer Institute, or Presbyterian Children's Hospital, where integrative oncology and acupuncture had been part of the service portfolio for years. These centers have plan-integrated complementary treatments such as acupuncture, nutrition, massage, or aromatherapy. In final conclusion, in attempt to prevent the rising tide of cancer and improve the quality and prognosis of the cancer patient, a framework of support for complementary medicines and integrative oncology is required at the level of the European institutions. Thank you for your attention.